Well, both.
Yeah. Okay. We can get into it. We can do super kind of informal. So front squat. We get a lot of just touch. Put like this. Turn it off. Yeah. So what questions, I guess, or is there like front squat coaching? Is there something that's like, this thing keeps popping up? We can kind of start there then.
Well, I'll tell you, I mean, I'm being selfish right now, like me. Like what I have issues with on front squatting is pretty significant from, I just think, years of being a bike racer. And so I've got a lot of internal rotation, dislocated this shoulder, I don't know, probably 6 times now. So I've got a lot of issues with scapular traction on this side. So I have a hard time getting in a position. I don't have the mobility through my shoulders and lats to get up there. I don't know what's going on through the hips that's causing the issue, and I think it's also thoracic on my left side. I think years of being a baseball player, and then also I was a bike racer when we were racing the track, and so I did a lot of left turns.
Yeah.
So like this is how I spent my life, and then also when it came to bike racing, I was a sprinter, and I would always start with my left leg. So I was always kind of left
Power
leg
in there.
powering. So
Okay.
I just have this general kind of natural feeling like my whole body's kind of pulled like this or something.
Okay. Yeah.
So
That makes sense.
getting into a front squat position is, and then getting deep is
Yeah.
somewhat uncomfortable for me. So I got shoulder pain that kind of constant, and had issues. I tore an hamstring last year, but
Okay. Yeah.
a lot of stuff going on.
Okay. So yeah, let's talk about first like scapular rib cage mechanics with front squat. Let's talk about deep hip control through the squat itself, and then bracing patterns we should be good on. So I have a lot of patients who, you know, when they squat, they don't understand how to control like deep rotation to be able to sit them from a nice upright position, being able to maintain upright, hit straight down and back up. Most people immediately lock into the anterior pelvic tilt, and what happens in the beginning of their squat is they're fine until they get about halfway, and then they run into their femurs, right? So if we're starting in this anterior pelvic tilt and you see somebody getting to this spot and they literally can't go anymore because they're literally blocking in here from femur and pelvis. So to get around it, people do the butt wink, because they're taking the pelvis out of that relative anterior pelvic tilt and then trying to maneuver around the femur heads there. So why don't we start with, we're going to start with a Zurcher variation, and we're going to try and find like deep hip control going from like top to bottom. And then we'll come back up top and start talking about like rib cage mechanics.
Zurcher's this one, right?
Yeah. Zurcher. We're not gonna load it like with a bar.
I've done those in my life.
Yeah.
What's the benefit of that relative to normal front or back squat?
I mean,
Front loading.
yeah, front loading. I actually tend to think they're a little more functional, right? Because generally we're bending, like in day-to-day life, we're bending down and picking things up. So I think naturally it's just a little more functional than like supporting something here or here. Yeah, but the variation we're going to do today is not going to be like a loading this way. We're actually going to load with a band pulling us this way, and that's going to allow us to sit into posterior hip a little bit more. So cool. So yeah, I've had patients before, like whenever we teach them how to actually get into femur rotation as they sit all the way down, they'll literally, they were squatting here before, and then all of a sudden they're able to control this rotation, and they'll get like literally stuck here. They don't have the strength because they've never been here before to like come back up. So there's been multiple times I have to like physically grab them and pick them up, not because they're in pain, just because they've never actually accessed that range of motion. So let's talk about it. Let's sit up here. We get one of these, one of those, and we'll use the rack the rig.
How do you want to, we can move stuff.
Let's go, this side will probably be fine. So this is a nice Zercher variation. And what we're gonna do is spend time. I want you to think of the squat as 3 different parts. And each part, we're gonna like kind of hang out there and over exaggerate the motion. So first part, I'm taking this band and I'm putting a good bit of tension on it. I want to get comfortable sitting into the back of the body. So by resisting that, I get comfortable into the back so I can actually load the hip more versus most people immediately squat. They shift forward and then they squat here. This is where they run into femurs. So first 0 to 60 degrees of hip flexion. So from about here to here-ish. We're gonna think deep hip is rotating out, right? So we're gonna take 3 different parts of the squat. We're gonna over exaggerate it and you're gonna find like a lot more control in this deep hip. So I'm starting here, right? I'm allowing elbows to come up and stay high. I'm gonna just start feet straight forward. We're always starting with our brace, right? Should be bearing down and pushing out for my brace. And then I'm gonna go from 0 to about 60 degrees. And now from here, spine should stay straight up and down. I shouldn't be collapsing, but I'm gonna focus on my sit bones. And I'm gonna try and sit straight down into them. So we're here, I'm sitting straight down into that sit bone, and I'm gonna literally just spend time here working on my breathe and brace. Can feel the 3 points of my foot, heel, big toe, little toe. We wanna feel that tripod. I'm nice and upright, and I'm feeling as if the knees are pushing out, right? So if we wanna over exaggerate it first, we can kind of push the knees out, but eventually we want the knees to stay in place, and you'll feel this little deep rotation here. And it'll feel deep in the hip socket.
So you want me to actively externally rotate the femurs, like as I'm try to push them out of them going down?
Yeah, so I want you to over exaggerate that motion as if I'm pushing out.
Almost like I got a band on, maybe?
Yeah, but as,
In my mind.
yeah, so if we over exaggerate it here, eventually we want to get it to neutral and then still feel this little connection.
Okay.
So I'm not necessarily driving knees out.
Okay.
My knees stay above the feet, but I want to feel as if I'm driving them out. And you'll start to feel this little rotation here that's going to lock this hip into place and come back up. So 0 to 60 degrees, we brace. I'm trying to sit straight down into that spot and then just feel that little bit of rotation deep in the hip socket. You're gonna try and maintain this 3 to 5 breaths. And then come back up. Cool? Let's give it a shot. There you go. Cool. So put a good bit of tension on that band. Like you want to really feel, yep, elbows are going to be high. Feel those 3 points of the feet. We always start with a brace. Our perfect squat, our torso stays straight up and down the whole time. Good. So keep super flat through here. Find your sit bones and then just sit into like a little mini squat. Perfect. Really good. Good. Super flat here. Maintain pressure with your breath.
Good.
Good.
Try
Breathe in, push the hands out.
Like tuck them the other
There
way.
you go.
Yeah, there you go.
Keep this pressurized.
Like getting my knees over my face?
Yep. And it should feel like deep in the hip is doing this.
Yeah.
But the
You don't
knee is
want
going
a
to
lot of
stay
force
in
that
line.
way, but
There
this
you
is
go.
a- yeah.
3 to 5 breaths, and then come back up.
How does it feel?
Good. How do we do with that? Good.
Cool.
Can you feel that deep kind of hip activation there? Mm-hmm. Perfect. This is going to be the easy version. Yep. Neutral spine. Think like you're
Good.
sitting right
You can
into
try to,
your.
like, get grandpa butt a little bit.
Good. Keep that pressure.
There you go.
There you go.
Like you're trying to point your.
Strong. Yeah, there you
Sit
go. Keep
bones
that the
down.
whole time.
I guess I didn't know what a sit bone was.
How's that feel?
Good.
Okay.
Yeah, I guess that's just getting my brain to control these things.
Yeah, so this could be a good drill for somebody who's like having knee pain when they're squatting, or back pain specifically when they're squatting. This is teaching them not to immediately lock into this, but to maintain stacked and be able to sit straight down into that squat and actually load their hips and not their back. So what's nice about this is you can cue them into like holding for a 3 to 5 breath count, and it's literally like it's a brain game. They're constantly checking back in with like core, hips. Okay, I can feel my feet on the ground, and we're just repatterning the squat here. So let's try one more on that. Where people get this wrong is they just drive the knees out, and it's really the deep rotation in the hip. Good. Super strong, nice and tall. And then I want you to feel as if this is happening deep in the hip. Good. There you go. Really good. 1 or 2 more breaths, and then come on out of that.
Go.
Good. Okay. Part 2. So, the oversimplification of the squat is legs rotate out, and then through parallel they rotate in, and then back they rotate out again, and reverse it. Right? So we're going to go to the second part. This is generally the hardest part because people aren't used to using their adductors to squat. Most of the time too many times, like people just bam their knees and just do a ton of squats like that, trying to force a lot of glute activation. You'll actually get more glute activation by activating your adductor because it pulls and orients back so we can actually load deeper into the glute. Counterintuitive, right? Because everyone says knees around to like activate your glutes, but actually a little bit of adductor activation is going to open the space up and allow us to load it.
It provides the stabilization for it to be able to pull from.
Yeah.
The stronger your adductors are, I assume the stronger your glutes will be.
Exactly. It's pulling the femur head kind of back into this posterior hip so that we can actually get drive there. So, part 2. All right, we're starting here, same thing. Good bit of torque on the band. Brace, and again, I'm just trying to find sit bones and sit straight into them. And my knees aren't driving out, but the femurs are slightly rotating. From 60 degrees through parallel to about 120, we actually want a little bit of internal rotation. So I'm going to over-exaggerate it by bringing my knees in. And what we're going to do is we're going to stop about halfway. Try and hold through there. And then reverse back up. This midpoint is going to allow the femurs to get out of the way of the pelvis so people don't have to butt wink. And again, the butt wink it's not aesthetic, they're chewing up their lower back whenever they squat because they're putting them into flexion and then extension under load, and over time, this is the people who throw their back out. So 0 to 60, I'm sitting right into that spot. I should feel that activation. And then 60 through, imagine like I have a ball between my knees, and I'm just gently trying to pinch it. And we'll get to about here. You can see like my VMO and adductors are like firing like crazy. And then I'm pushing my feet through the floor and trying to reverse that deep hip activation. Really good for people with back pain whenever they are squatting. Also, people with knee pain when they're squatting. Most people get this lateral knee pain when they squat because they've been taught to like push knees out like crazy on everything, and it just overloads all this tissue. So actually getting into a little bit of here. And I'm over exaggerating by moving, but we're just imagining like I have the ball there and then I start holding. See this VMO starting to fire up? This guy twitching too. This is gonna pull, if somebody has knee pain out here, this is gonna pull this kneecap back into activation so it's in line. I just had a patient, new patient yesterday, came to me, she's got knee pain. Went to an ortho, and they basically just told her, like, yeah, there's nothing we can do for knee tracking. You're just gonna eventually have to get a knee replacement, which is like so not true, because this type of thing will keep somebody out of that. Just learning how to actually activate your adductors and start firing up these VMOs. I played hockey last night, so my legs are already pretty sore, but so again, one more time. Zercher. Good bit of pressure, so we're forward front loading this. Initial, we're thinking out, through parallel, we're thinking in. And I want you to hang out about parallel. Imagine like you're pinching that ball. Breathe and braced. I can feel my feet on the ground, and then pushing feet straight down to come back up.
Would this be beneficial to ever do isometrically with, say, at the high point with a band on, at the midpoint with a ball, and at the low point with a band on? Like, would that be appropriate?
I would do it with the ball between the knees before the band.
The whole time? What I'm saying,
If we're gonna like isometrically, if we want to load the adductors in here because somebody's getting knee pain out here, I would just do the midpoint with a ball. I've yet to really find a patient that benefits from bands outside of knees.
Really?
Right? How about you? You're kind of the same, right?
Yeah, we've talked about that.
Yeah.
That's a big thing.
Is it centered?
Just because I'll see a lot of glute medius minimus, just weakness. So I just use that to help build that.
Yeah, and I mean, it can. Glute med and min should be more involved in straight leg control versus squat control.
Good.
So, yep.
Yeah.
You're getting to that.
So if I can pull them back.
Getting to
Let's try
about
again.
parallel.
Is it the knees or the toes?
Don't lean too far back.
Yeah, and just
Yeah.
imagine like
Yeah.
you got a
Yeah,
gentle
try to
ball
stay
between your
tall.
knees.
So
and
we
you
need
should
more
start
weight
to feel
here.
adductors firing
Here
up.
should be even.
VMOs going nuts.
Yeah, there you go. Good. Tuck the pelvis
Hold
a
them
little
3 to
more.
5 breaths.
Yeah, there you go.
We're
And then
rechecking in.
squeeze here.
Proper braced.
Yeah.
3 points of contact through the foot. Back up.
Good, and then come
How'd
up.
that feel? Good.
Is that better?
Yeah. Well, I just feel like without this, I'm gonna like have to hinge over.
Yeah, so this is just teaching. This is I think of this as like a crutch,
Yeah.
right? As you get better at it, you won't need that and you won't have to hinge forward.
Yeah.
You'll be able to stay upright to squat
Yeah.
down and back up. This is really allowing us to retrain and get into deep hip. You'd be amazed how many people
Good, yeah.
who have knee pain when they squat, if you do this drill with them, especially this second part, and like just have that gentle activation here, knees will feel so much better, like right off the bat.
Okay. Yep.
And because they have
Tuck
knee pain,
butt.
because everyone
Yeah, there you
cues knee out, because everyone's so scared of knee valgus, but yeah, there you go. How's that feel?
Better.
Yeah.
Yeah.
Good.
I've been having hip problems with my left one anyway.
How does that squat feel in your hip?
The hip's fine.
Okay.
I mean, I do gymnastics. So this one pops a lot when I lift it. I like doing kind of like flutter stuff, and I do a lot of martial arts kicks, and it can pop. I feel like it's like the whole thing though. Sometimes I feel it like more out here. Like I thought it was like maybe like what he was talking about, the medius being kind of weak, but I also think it's kind of crunched. Sometimes it feels jammed. Like
Yeah.
it's too far in or something.
Do you ever load your hip flexors, like strengthen them as they're opening?
Yeah.
What do you do?
Well, I used to do like where you would lift them, like you have like a kettlebell or something, like lift them up and over. I've also done like where band stuff, like that.
Okay. I'll show you one that'll be great, and it'll be good for people here too. Yeah. Okay. Let's come back to this. So part 3 is the finish. Arms are up. We've got this tension. I'm nice and upright, feeling the floor, and I'm just trying to go literally from straight up to straight down. I'm thinking out, in, and then once I get past parallel, I'm thinking out again to make room for my hips to sit down in front of. And this is where people will literally get stuck because they've never had this range of motion before with like actual good form. So to come back up, you have to cue them into a really strong brace here. Like a, because if you don't, they'll immediately fall out of their trunk and start activating their back. So strong brace, knees slightly out, in, out again. Yeah, getting them into that will feel like the craziest squat because they'll actually have room for the femurs to sit straight down and then drive. And again, we just reversed the order. I'm thinking out, in, out again. Knee isn't necessarily moving. You can when you're coaching it too, you can over-exaggerate that and have them over-exaggerate it first, where it's like out, in, out again, out, in, out, and then just make that smaller and smaller till their knee's not moving. Cool? Let's try that. Yes, everyone's so scared of like knee in. If you watch Olympic weightlifters, all of them drive through that knee in because they actually know how to use their adductors.
Good.
Yeah, once you get past parallel,
hips.
think out again.
Good, out.
And it's almost like your hips are getting pulled in between your heels.
I'm surprised I can't go low and keep my heels on the ground.
I'll give you a couple tips.
Good. Whenever you're ready to come up, super strong brace. Like can't stress that enough because if we lose that brace, immediate
Keep
low
the
back.
elbows up because you're dropping.
It's going to take
It's
over.
going to pull you forward like this. Yeah. And then be patient, especially when you get to parallel. Yeah.
Strong brace whole way down. Don't lose it.
Good. And then
We're
now
thinking
bend
out. We're
knees
thinking in.
out. A little bit more out. Good. And then keep.
Once we get
elbows
past
up.
parallel,
Yeah.
we think out
Yeah,
again,
there
like
you go.
your hips are pulling between the heels.
Good.
Nice. Good upright posture. Make space for the hips between the heels. Brace to
Good.
come up. We go out.
In,
We go
out.
in.
You know what I notice myself doing? As I'm coming up, like
I feel like
Ankle
my-
mobility is a little bit of a thing.
parallel, I feel like I'm
Yeah,
almost like
this is forcing you to be more upright and putting more weight in the
like
quads.
almost like a
You're probably used to being more
extension with my lumbar.
in a
It's
hinge.
weird, but I
So-
only do it for like that split second. It's like I feel like
Try
I
to keep
have
your
do
gaze
that
like
when I'm trying to-
forward.
Okay.
So like we're just constantly
So
looking.
you're probably losing
up,
core.
up.
That's what it feels like.
Yeah.
Yes.
Because you looking down is gonna
Engage
make
a
you
little
come
tight
down.
on my psoas. That's what it
Good.
feels like.
Yeah. So on
Good. Tuck, tuck, tuck.
on your way
There you
up,
go.
imagine
Tucking.
like you're blowing
Chest
up a
up.
balloon or
Yeah.
doing like a shh
Little
from
better.
the bottom up.
Good.
So as I get all the way down, I'm gonna brace, and then I'm gonna go
Try pulling some of the weight back. Yeah, there you go.
and like try and
then
like
now come up.
squeeze the air out so that this stays
Cool.
cylindrical and I
How was
don't
that? Better?
lock into this.
I'd say, yeah, like ankles are playing a little bit of a role for you too.
Yeah, it's the balance. I feel like I have to sit back.
And it's the second day you worn those shoes.
Yeah,
So,
yeah, yeah. I actually like it though. I can see what I'm doing.
yeah.
I like to maneuver.
There you go.
When we
Yep.
often do
And then strong
movements
brace,
like
and then
this,
exhale,
we also
strong
have
exhale.
heels elevated for
Pull ribs
folks.
down over pelvis.
too, which
Yeah, that was better.
So I'd say for you that would benefit because you are kind of like still
Yeah.
having that hard time connecting with the core. So I'd say like we would have like heels slightly elevated so you can
Yeah.
be a little more
That's good.
vertical in the torso.
How's that squat feel compared to before? So try one without the Zercher. Let's grab like a kettlebell so we can front load. Grab a kettlebell or dumbbell, something light, and just add a little bit of a front loaded position. All right, however you want to hold it. Sit, knee in, knee out, and then just try and keep that upright posture. You can see like my hips have been pulled underneath into my heels. This is because we're focusing on that sit bone. focus on the sit bone, actually activate our hamstrings when we squat instead of just doing quads. Obviously, squat is a quad dominant movement, but it doesn't mean we can't use hamstrings. So as we sit straight, out, in, out again, we're able to keep that upright posture. And then we just reverse. So grab a light weight, try it without the band. See if you can maintain, keys, kettlebell, dumbbell, whatever. Load is load. Cool. Strong brace, fine sit bones. Yeah. Think out, in, and then out again. Pull in the hips in between. Keep your core braced. To come up, strong brace. Strong exhale to come up too, so that we don't lock into low back.
Noticing when I get low, I sit on my heels. I lose and then I'm recruiting. I think it's because my brain programmed myself. Remember way back, don't squat on your heels, get back on your heels. And squat it that way. That's how I learned how to squat. I think that's what's happening. I'm like literally, my brain, because as soon as I start
push
coming
through.
I'm off my heels.
Yeah.
And I'm sitting back.
So find, especially this big toe knuckle.
Here's my hips crack. My knee, this knee's like, it doesn't hurt. It just, I hear crack.
Okay.
Like something's just rubbing.
Okay. Every time.
Yeah, those two
Funny
times.
is I normally can
Okay.
do that. I'll
it's
train
not
all the
hurting
time on that toe knuckle. I just haven't noticed how
Yeah,
much I come
say
off
for
of it.
you, we need to work on loosening up the ribs.
Yeah.
Yeah, so as you come up, focus on pushing through your midfoot. Good. Keep core
Try to
super
keep
braced,
kettlebell- or
stiff
dumbbell a little
cylinder.
closer. Yeah, there
It's
you go.
only the hips working. Yep. Strong brace to come up.
come up.
Push through the midfoot like
So
you're
for
pushing it through the
you,
floor.
I'd
That look
say
better.
it would be good just to go from 1 to 2 instead of all the way down, because it's from 2 all the way down to the bottom that's the really sticking point for you.
Yeah.
So like, if you were working with me, I would keep you at 1 and like 2 and just owning those positions.
Yeah.
And then as we open up everything, the bottom
There
position
you
will
go.
be much easier to get into.
Yeah.
Nice.
Yeah, it's because I fell off balance when I started to get
Yeah, I can see
Yep,
that.
yep, yep, yep. That was way better. Nice.
It's about being present and being actually focusing on what you're doing. Rather than just trying to lift a weight.
Run with the dumbbell.
Yeah. Okay, let's talk about pinchy tight front hips, because this is actually valuable to the squat as well. This is called a hip flexor sit up. Pound for pound, really, really solid. I don't think any of those are heavy enough. So I just took, shoes off.
There we go.
Yeah. So, people with lower back pain, people with pinchy tightness through here are gonna have a hard time squatting, because this is immediately gonna pull them into this anterior pelvic tilt, and then it's hard for them to brace their core, it's hard for them to use their glutes, and it's because all of this tissue is just getting pulled and tight right here. You can stretch it, but it doesn't really fix it. We have to stretch it under load, because that's what makes the system respond. Should have taken that out before. Anyway, I'm probably gonna be super shaky on this. So hip flexor sit up. I'm trying to lift this bell up, or dumbbell. I like to start people holding their knees because it's a little bit easier. And I'm just gonna go super slow down and just barely hover my shoulder blades up off the table and try and hold for at least 20 to 30 seconds. Without this, it becomes much harder. Normal to be shaking a little bit, and then we try and, the whole time I'm trying to lift this knee up. And so we can do reps of up and then slow and back up. Starting people who have like active hip tightness, really pinchy in here, start them with 30-second holds. And what'll happen, well, we'll see if it happens to you, about the 20 to 30 second mark, you'll feel all of this like tightness here, and it'll feel like it kind of melts away. So the best thing whenever I cue this, I'm like, you're feeling for a change where this kind of is like if it was on this side, I would just feel it all kind of bound up, and we're holding here, and then after about 30 seconds of holding, all of a sudden I'll feel it just kind of like open up. And that's where we know the tissue is finally kind of relaxed and gets better. Important, because if we have sharp, pinchy, tight hips in the front, over years and years, it chews up the hip joint itself. Eventually, it leads to hip replacements. So, do this exercise, and it will stop that from happening. Cool?
Is there a point at which it's good to do it? Because when I do it, I don't do isometrics. I'll go over this way and actually go into a negative. But I'm saying, should I, for the isometrics, do you want a little bit more support on the lumbar for the isometrics to learn? Or
early on with people, we'll put them this way. If it's more advanced, then yeah, we'll turn it that way and hold. Just to give people that like safety net behind them. But I like turning the bench the other way and going into that pass like negative and then doing an isometric there. So, you ready? You want to try this? Yeah, I'm sure. Super excited. So, no, that's fine. We just want something heavy that's not going to pull up. Okay.
You want me to start with this one? 'Cause that's what I have a problem with.
Yeah. So yeah, if you get somebody who's low back pain, sharp, pinchy, you just see them squat and they're just doing this, it's just because all this tissue is so tight here, they literally can't get into a neutral position. Mm-hmm. So this is a great exercise to just open that up. So yeah, start. Just loose, just hold on to it for the first rep, core brace. And as you lower down, think like this knee is trying to lift up off. There you go. And you're just gonna barely hover right here. Keep trying to focus on that knee coming up. And what we're feeling for is right here. Right now it probably feels all jammed up. Yeah. You'll feel about 20 to 30 seconds of change. So this would be super important for you because your kicks are compressing this. The hip flexor exercises you're doing are fine, but they're not putting the tissue in an open position. There you go. Feel it starting to change?
Yeah.
Good. I know, it's tough. Everyone's shaky on this, so there it goes. Do you feel it kind of melt away? Mm-hmm. Cool. Come on back up. Try and use your knee and hip. Yep. Do 3 reps. Slow negative, about 2 to 3 seconds down, and then back up. Yep. Allow this to fully lengthen, and then back up. Good. And so again, feel how much different that feels? Mm-hmm. This is great. Stretching won't really touch this. Doing the isometric hold before allows the tissue time to respond to it. And then we just teach the brain, look at that. That's way better. We're just teaching the brain that it's okay to activate.
Yeah.
Try standing up and moving around a little bit.
Yeah, I normally feel it kind of popping. It's fine. It's not popping.
Mm-hmm. Good.
Yeah.
Good.
I need to do that regularly.
Yeah.
Yeah.
Again, really good. Especially that popping, clicking is all that tissue just bound up in there, and the joint's just getting pulled and kind of beat up.
Yeah.
So do the holds. I always like to start people with the holds first. 20, 30 seconds, and you kind of felt it, that like change. And then we can do a couple reps. Emphasis on the negative.
Yeah.
Yeah. Cool. The isometric just gives people time, because if you're already doing it, it's great. Start people out with the holds like that, and they'll feel that like release in their hip. And a lot of times people after will stand up and they'll be like, oh, like I'm standing taller, because all of this isn't pulling them forward anymore. Which this pulling forward turns into lower back arching, turns into shoulders here. people don't realize they're walking around like this, and then we take pressure off of this, and the whole system's like, oh, shit, okay, we can actually move. Cool. Questions on squat or those?
Can you watch me when I do this?
Yeah, yeah.
On both sides, because this is the thing. I have this idea in my head that I have my
I like that.
left hip flexor is tighter than my right. But my right is stronger. I have this idea that this is opened up, and when I'm doing this, I'm recruiting different muscles on each side. So can you just watch me?
Yeah, yeah, absolutely.
When I do this, I'm kind of thinking, I'm trying to lengthen fascia too, so I'll hold on with one hand and I'll go up like this. So this is the side that I think is tighter, right? But I don't necessarily know that it's weaker. So I'll come down here, you know.
So you're losing.
So that's the other thing too. Should I brace my abs the entire time?
Yeah.
So keep them engaged. I was thinking since the hip flexor move, almost allow my abs to open. So to disengage.
You're by allowing your abs to open, all you're doing is you're losing the core, but the lower back is going to remain arched,
Yes.
and those hip flexors stay connected to the lower back. So you're getting to a certain point, and then you're losing core, but lower back stays in place. And it might feel like more of a stretch, but the actual hip flexor isn't
It
opening.
makes sense though, because nothing I'm going to do in real life is going to be hip flexor without the abs engaged too. So I'm kind of teaching myself
Yeah.
something I'll never do.
Yeah, just maintain this stacked position, and then just try and let it all open up here.
I mean, I'm significantly stronger when I stay tucked. But I was thinking of isolating the psoas, but it actually doesn't make sense because nothing I'm going to do. I'm never going to run without my abs engaged. You know what I mean? It's not like I'm going to run with psoas alone.
Yeah,
You know?
yeah. We want all that tissue to strengthen and connect and lengthen together. Right. So actually, on your left side, you actually didn't get into a neutral hip because you got to about here, and then you let go of your core, and your pelvis stayed here, but the rest of you went further back, right? If you maintain this, you should have gotten to full hip extension. Well, not full neutral position, and then been able to hold or even go further from there. So, yeah, for sure, keep core locked in on that one.
That actually makes a lot of sense now.
Cool. Other questions? Good, just here, we're hanging?
Yes.
Cool. All right, let's do upper body. First thing everyone talks about, and we were talking about this when we were prepping for this. I have a terrible front rack position. This side's fine. Like I can get into good elbow position. Years of boxing, like beat the shit out of this elbow. So whenever I'm here, great. Like I get really stuck here. I don't front squat enough to like really get in and like take care of it. I was telling him, guys in boxing will throw punches at your hands to beat up your elbows. So you get this like overextended position. I used to spar with a guy who always targeted this hand. So anyway, I get stuck about here. I could get into a better position, but I just need to open all this tissue up. Most people have the elbow pain because of their wrists and hands. All right, so one of my favorite exercises, I do this preventatively all the time just because like what we do. We're constantly lifting and moving and working with our hands. Hands get really tight. If you have someone who's typing a lot, all of the flexors in here just get so tight, and then we're not able to fully open in this position, and then we get pain here. Problem isn't really here. The problem is that we're not getting full wrist extension. So this is called a first knuckle push-up. Anytime I do an exercise where I'm touching the ground, I always do this. Like if I take class here and you see me in the back, like I'll be doing these reps because it just preps the hand to be able to stay strong on the ground. So what it is hand is totally flat. This index finger knuckle is down. And I'm going to press and lift up onto all 8 knuckles. So across and across. And then I'm going to go 2 to 3 seconds, lowering down. So we press, hold, 2 to 3 seconds, lowering back down. And try.
How much tighter my right is than my left. Crazy.
The closer, so that's super common. So that is actually full range of motion is 90 degrees. There you go. But we need to be able to own that range of motion under load. So like anywhere 5 to 8-ish reps tends to be pretty good. And yeah, you're gonna feel a ton of like tension through the hands. And so for people who are having elbow pain during a front rack, this is really commonly it. You have them load this tissue, and right after, they're actually able to get here and be comfortable here. Personally, I do this anytime I touch the floor. It's it comes from a gymnastic strength training protocol where the gymnasts use this because they're rebounding and doing everything off their hands. So you'll see gymnasts before, right, doing reps of this. Once you get better at it, then we can actually go into more of like a push-up position. You can go like up, up, and then slowly down. But it really just preps the hand for solid contact. Yeah, up, up, and then slowly down. Yeah. If you see somebody who's like having trouble crawling in here, maybe they're like, I've seen people when they're doing like bear crawls and they'll be like trying to like go like this or whatnot. It's most likely because they're getting overstretched through here and this tissue isn't used to that load. So this is a great exercise to just have them start building that strength to touch the ground. Cool. How's that feel?
I mean, this is my left one's tight.
Okay.
Yeah. I have bad wrist from jumping. But I also screwed myself by wearing the tiger paws because I sprained my wrist or something. And then the tiger paws have like that, so you have like it weakened them.
Yeah. This will be good to strengthen them. Yeah. Okay. Let's do one more for upper back and front rack position. So this will be good for you here. And we're going to use a PVC pipe. Getting a little bit, I would have definitely forgot that. Getting a little bit of rounding in the upper back allows us to fully protract the shoulder blade forward, and that way we can actually get our elbows up and create this shelf. If we are over extending our back, it becomes hard to get elbow forward, right? If we're overcorrecting our posture, meaning we're just pushing that rib cage, it's harder for us to extend because the rib cage and shoulder blade connection become off. So we actually need to make sure that we keep always first core and a little bit of upper back openness so that we can press those elbows through and up and be in a good front rack here. This is one of my favorites to start people with before really teaching them to get up into their upper back. So, PVC pipe, I'm on my elbows, and I'm gonna reach my hips back, and elbows are gonna be about shoulder height. I'm pushing my elbows forward and down, and you can see they kind of lock into place. And then what we're actually gonna do is we're gonna do anywhere from 5 to 8 breaths here. Each breath, I'm gonna try and get up in between my shoulder blades and back down. Breath up, in between the shoulder blades and back down. So you'll get a decompression up in between the shoulders into the rib cage, which feels really good because the lungs, as we breathe in this position, are actually getting those ribs to expand backwards, and it takes a lot of pressure off of that upper back. Really, really good for people who are like constantly tight between their shoulder blades, right? They're always kind of like doing this, so they're trying to stretch it. That tissue and rib cage is just so bound up there. This is a really good way to open that up. Cool? Give us a shot. I'll put this guy back. Whee.
So reverse grip or here?
Hey, yeah, before.
Probably, yeah, makes sense.
No, you were right the first time.
Oh.
Yeah.
Good. And so you're not, yeah, just about shoulder height with that. Yep.
Good. Just make
Pushing
sure
elbows
you're getting it
forward and down.
Yeah.
Neutral spine,
Strong
maybe
core,
a little
yeah.
bit of rounding through upper back.
Yeah.
And then as you breathe in, get that breath up here right in between the shoulder blades and just kind of feel those ribs move, open and move. Good. Inhale, you get that
Good.
expansion
Big breath.
back.
Big breath. Yeah.
And it should feel like a little decompression in between the shoulders. And we're really strengthening this shoulder blade rib cage connection by getting proper, yeah, there you go. Perfect. That's what we want. Nice and soft right there.
Good.
So anywhere from 5 to 8 breaths. We're looking for supple strength here, not a ton of tension. Good. How'd that feel? Yeah. It's a nice simple prep to open up the upper back and allow us to be able to get into that front rack. How'd you do with that?
Better than I thought I was going to. Actually,
Good. Good, good, good. So after that, come on up and then just try like before. So even mine, like I said, mine is years of this elbow being jacked, but already much better.
I need more weight.
Yeah, that definitely helps.
y'all do anything for bunions?
Yeah.
Yeah, good.
My husband has bad bunions.
Okay.
One's because he broke his toe.
Good. So let's try,
That way.
Yeah.
go through a full
So I don't
front
know
squat.
How much you can deal with that since it's probably bone.
Strong
We
brace.
can't
Fine sit
make
bones.
it like
Yep,
go
we're
away,
thinking
but
out.
we can make it not get
We're
worse.
thinking
Where-
in.
Yeah, it's more functional.
It hurts them. And then
Keep
the
your
other one,
core
he
super
just-
strong. Fine sit bones out again.
has bad feet.
Pull the
Yeah,
hips
tell him to
between.
get wide pair of
Good.
shoes, toe spacers.
Strong brace. Strong exhale to come
and
up.
It would be teaching
in,
him how to like
out.
get
Yeah,
his
that
toes
looked pretty
kinda,
good.
like pivot in. Yeah.
The one he broke is like
Worse.
it's like all the way under his second.
This
toe.
area
Like,
wants
Okay, yeah, then he did. Start with toe spacers and wider shoes, and then there's exercises that we can show
yeah,
you.
like band stuff. I do like
structural
the,
issue,
I have like
like
a
just
band.
like
I'll put my
postural,
toes and kind
fascial
of pull
issue?
apart and
Yeah.
like
Or is
make my
it
feet touch the
strength
ground.
Yeah.
on the opposing side of my body? Do I need to?
Probably both. So do this breathing drill. It's your left side. So I'm gonna hold on to this. I'm gonna step the same leg back, and then I'm gonna start to turn, and it's almost like I'm hanging off of this. I'm gonna take my other hand and go over that spot. And what I want you to do is as you breathe in, try and get all your breath into that area. And then as you exhale, let it drop. Yeah. So what you're doing is you're just mobilizing through this. What we can do as a clinician too is we come in with a Grasson instrument and we mobilize all of this tissue to like get the fascia moving.
It feels like I got a bunch of Velcro right there.
Yeah.
That's what feels like it's going on. It's like this.
So try and get, there you go, all that expansion into here. There you go, good. And it probably is all bound up from years of this.
It's all left turns. I grew up doing left turns like this, and staying as tight as I could.
Yeah.
And it was like this.
Yeah, so it's, I mean, you can open it back up. You just gotta get into it there.
I was thinking I'm, doing TFL, like, I need to get the whole thing. This is where I even got pain right here right now. I worked out the other day.
That, yeah, we've done that with patients, and they'll, like if you're looking at their back with their shirt off, they'll literally have the line.
I have a crease right here. So I saw that last week. I took a picture of myself, and I have more of a line on my left side than my right.
Yeah, that is that fascia just compressing this down here. This breathing drill is great to open it. Also getting in, like grassed in works really well with that. You could put cups on through here and then get into that breathing drill. That crease will actually go away once, because essentially just all the tissue here is just bound up and pulling you in. So eventually, once it opens, it'll open and clear itself out. So.
I've been dealing with this forever now.
Yeah.
Forever.
Yeah.
And I was thinking it's because I've dislocated the shoulder so many times, and that's why the shoulder hurts. But then I started going, you know, my shoulder's okay. It's like I can't come here. This doesn't want to open up.
Yeah, and if that doesn't open up, that's going to reach extra, and that's where it gets injured. Even as you're stepping, every time you step, you're getting, like you're stepping and like compressing to the side a ton. So, breathing drill, 8 to 10 reps at a time, like twice a day is great. And you'll literally, like, you can get into different like aspects of it, and you'll feel that expansion, compression, right? You can kind of, I like to reach straight back and then take this twist, and it really like binds up all the fascia. Yep. There you go. Yep, and then you're just trying to feel all the breath expand.
That's what I do is I hold my breath, and that's the problem.
Yeah, we want to get the rib cage mobilized and stretched and moving through there. Yeah, there you go. Very nice.
I got a lot of them. It feels like I opened up my lap before.
Yeah, all connected. Cool. So that little squat pattern's great, again, for someone who's having lower back pain when they're squatting or they're having knee pain. Especially the knee pain, cueing them to getting to here and not just driving out, but putting a gentle pressure in will immediately take that kneecap and track it inwards. As long as we have a stable foot, right? So shoes off is better than shoes on. If you just see an excessive, like, and I've seen it before, right? Everyone's seen it when someone goes to squat and they're, you know, like this, have them do that hip flexor sit up and hold, and then that's gonna just allow them to open up through here and actually sit straight down into the sit bones. Yeah, elbow pain, we've got the first knuckle push-ups, and then driving up through this.
Quick question. If I tell people when they're RDLs or deadlifting to really almost try to overextend the lumbar to brace for strength as they're going down. Would you have them keep a little bit of neutrality in the lumbar as they're deadlifting RDLs?
Yeah, if you have them overextend lower back.
Almost have them like lock it in and then go down, especially for an RDL.
Yeah.
Just to make sure that they don't break.
They will end up using a lot more of their lumbar erectors than they will the hamstring and glute.
Okay.
So just maintaining this stacked rib cage, pelvic position, straighter leg for the RDL to get the hamstring, knee has to keep above ankles. I have to have this positive shin angle to be able to load the glute. But if I maintain this, we'll get into this more. So, cool. What's up, dude?
What's going on?
It's all good. We're just finishing up.
Signed up for the noon, but I was the only one.
Oh shit, it's 2
I'll be
minutes.
with you. I'll train with you.
Cool. All right, y'all. Appreciate it. We'll head out.
Thank you guys very
Cool.
much.
Thank you.